Dr. Murray, what are some of the most important dietary supplements for us to take? And give us a little idea of the scope of value that dietary supplements can have to our total growth.
Well, I think there are three key supplements that everybody should be taking. One is a high-potency multiple vitamin and mineral. Vitamins and minerals, they work in our body as components of enzymes. Enzymes either build other molecules or break them down. An enzyme has two arms. One arm holds a vitamin, the other arm holds a mineral. So in order for that enzyme to do its job, it needs to have both arms occupied. So we want to make sure that we have both vitamins and minerals that our enzymes need. Next, everybody should be on a good greens product. Now, greens products are things like spirulina, wheatgrass juice, chlorella, barley grass juice. These super green foods are just fabulous in their ways to protect our cells from damage. And studies have shown that diets that are higher in these sort of phytochemicals are associated with a significantly lower risk of all the chronic degenerative disease, not just heart attacks, diabetes, strokes, but things like macular degeneration, cataracts, Alzheimer's disease, Parkinson's disease. So any chronic disease, we can substantially reduce the risk by increasing our intake of these important phytochemicals that we can get from these super green foods. And lastly, without question, everybody should be on a high-quality pharmaceutical-grade fish oil. These long-chain omega-3 fatty acids that we get from these fish oil supplements, they're so important in helping us protect ourselves against heart disease and major forms of cancer, helping our brains function to their optimal capacity, and they offer significant effects in reducing inflammation. So those are my foundation recommendations that everyone should be utilizing. A high-potency multiple, a good greens product, and a pharmaceutical-grade fish oil. If someone has specific issues, maybe they have osteoarthritis, maybe they have high cholesterol levels, or maybe they're dealing with severe inflammation, then I'll have some specific recommendations. For example, in osteoarthritis, I love MSM and glucosamine. These are fabulous natural products with great scientific evidence of safety and efficacy. But since sometimes they don't work as fast as the drugs, they may get discouraged. So I like to recommend another product to be a companion to those, which is a product called Celadrin. I like the cream. Studies with the cream have shown that it will reduce pain and inflammation within 30 minutes of application. So, just because something's natural doesn't mean it has to take a long time to work. Glucosamine, MSM, those sort of structural support agents, they generally take 4 to 6 weeks of time in order for them to really come into their full efficacy, whereas the Celadrin, boy, it can be used immediately while the body is beginning to utilize the benefits from the longer-term therapies.
I'd sure like to second what you're talking about there. I think the cream is absolutely marvelous. I think that the pain relief that you can get from it is terrific. And I think that it's a shame that more people aren't availed of the information that they can use when they have these kinds of problems, where they could have just a radical change in those circumstances.
Yeah, people, they have to get informed. And, it's sad when people are uncomfortable, they're in pain, they reach for drugs most often. And what they don't realize is that, those drugs, they may suppress the symptoms, but they may create a whole list of other problems. And so when you can use something that's very effective without any side effects, boy, that's fabulous. And we know that about the Celadrin.